What is the impact of COVID-19 on the sexual functioning of an individual? Let us talk about this topic in this video. I'm Dr. Praveen Tripathi. I'm a consultant psychiatrist and sexual disorder specialist. So recently an article was published in the journal Andrology, and basically in the study the investigators were trying to find out whether there is an association between the diagnosis of COVID-19 and erectile dysfunction prevalence. And the study was being primarily done in younger population, younger people. So the results were quite concerning. They found that those who had a diagnosis of COVID-19 had almost six-fold higher chances of having erectile dysfunction. So a clear-cut association was found between the diagnosis of COVID-19 and the presence of erectile dysfunction. Now, as of now, it is not clear what causes what, or what is the exact root of this finding, what is the exact cause for this finding. But the investigators were able to hypothesize a couple of things which make a lot of sense. For example, the coronavirus, which is causing COVID-19, has a propensity for endothelium. Endothelium is this inner layer in the blood vessel. The innermost layer is called as endothelium. So coronavirus tends to impact this inner layer or endothelium, and we also know that endothelium is extremely important for normal sexual functioning, because many of the chemicals that are released that lead to increase in the blood flow, which finally causes erection, they are released from the endothelium. So one hypothesis is that by virtue of its impact on endothelium, the coronavirus might be causing decreased blood flow and erectile issues. Another hypothesis is that coronavirus tends to enter the cell with the help of ACE2, angiotensin converting enzyme 2. So it attaches to that particular enzyme and enters the blood cell and enters the cell. And this particular chemical is also found in abundance in Leydig cells. Leydig cells are basically there in testes, and Leydig cells lead to release of testosterone in the blood. So another hypothesis is coronavirus impacts the Leydig cells, which in turn leads to a fall in the levels of testosterone, which may in turn lead to the sexual dysfunction that was seen in this particular study. So these two hypotheses were given by the investigator, and both of them make sense. Although more research would be required to find out the exact mechanism, but at least this association is there, that people who had COVID are 6 times more likely to have erectile dysfunction. Another interesting aspect of the article was the fact that those who already had erectile dysfunction are at much higher risk of contracting coronavirus in comparison to those individuals who do not have ED. So if somebody is having erectile dysfunction to start with, the chances of contracting COVID-19 are much higher. And the possible reason is that presence of erectile dysfunction is kind of indicative of the general health of the individual. In particular, the cardiovascular system, whether it is working well or not, can be gauged with the help of the erectile functioning of the person. So if somebody is having erectile dysfunction, there is likelihood that there is some issue with the cardiovascular system, and we know that people who are obese, people who are old, people who have higher hypertension, people who have diabetes, all of them have higher propensity for development of COVID-19. So probably by that mechanism, by virtue of similar risk factors, people who already have COVID-19 are also at risk for developing, people who have ED are also at risk for developing COVID-19. So with more research, things will become clearer. But as of now, we must remember that COVID-19 or coronavirus infection is not just another flu. It is a serious illness. This illness can have long-term consequences. It may impact your lungs, it may impact your heart, and as the study showed, it may have a long-term impact on the sexual functioning of the individual too. So it is very important to take all the precautions, to use mask all the time, get vaccinated whenever you get chance, maintain social distancing. All the precautionary measures should be taken because as we just saw that the implications could be far-reaching. The title of the article that I just discussed is mask up to keep it up. So basically they are saying that if you don't wear mask properly, you may have issues with erections. So please keep that in mind and stay safe. Thank you.